Let's stick with this topic and bring in Dr. Andre Campbell, professor of surgery at UCSF and ICU physician and trauma surgeon at Zuckerberg San Francisco General Hospital. Dr. Campbell, thank you so much for your time this afternoon. As an ICU physician, in the past several weeks, what have you been seeing in terms of the volume and severity of cases of patients with COVID coming through your hospital?
Well, first of all, thank you for having me. It's unfortunate that the pandemic continues. So what have we been seeing here in San Francisco? And that is the numbers of cases have gone up dramatically from just a couple weeks ago. Now we're up to about 40 in our hospital. At the worst of the first wave or the second wave, so to speak, in California, we had up to 71 patients. We have about 8 in the ICU. But what's happening even more now, which is really dramatic, when we didn't have it last time, and the virus is burning through the staff at the hospital. So we have hundreds of nurses, support staff, even some of the doctors fell ill from this virus. So this virus is accelerating in a way it's burning through the population. There are about 145,000 people who are hospitalized, and that's way more than before. The incidence of daily infections are twice of what it was before. They mentioned milder. Now remember, 62% of people have 2 vaccines, but only 20 to 30% of people have 3. Fully vaccinated, and my estimation now is 2 shots plus a booster. That gives you the protection. So if you get it and you're fully vaccinated and boosted, then the incidence of your infection may not be as bad as it was before. But we're really teetering on the brink in healthcare because we're getting really strapped to the max with respect to the numbers of cases that are happening amongst the healthcare providers providing health, but not only the doctors, the nurses, the support staff, the janitorial staff. It's really affecting us tremendously at this point in time.
Dr. Campbell, good to see you. I'm almost ashamed to ask this question because the medical people, whether they be doctors, nurses, anyone in the hospitals who have been working now 2 years to protect people, certainly need a break. But we're hearing stories that in some medical facilities, if someone tests positive for COVID, they're still saying, if you're, not ill, but you've tested positive, you can keep working. Now, we have not independently confirmed that. It was a story that might not be 100% accurate. But have you heard of anything like that? And would that be a foolish thing to do?
Well, what has happened now, this is the reports I have heard now. At our facility, it is not like that. So you get tested, you go out for 5 days, then you get retested. And then at that point, they decide whether or not you can come back or not. So many times people come back at 8 or 9 days after they've been infected, but we do not have that policy. I've heard that. I don't think that's right. I think that's wrong. But what has happened is people are running out of healthcare providers to take care of patients. So that's why you're hearing these stories, not at our place, but it is beginning to creep in. But I think that is the wrong thing to do. I think if you're sick, you should stay home because you do not want to spread the infection to someone else. What happens in our system, you get sick, you get reported to the healthcare authorities here, and then they guide you through the path back to work. That is the correct way to do this.
In San Francisco and the surrounding areas, do you think you're past the peak for this wave of Omicron, or do you still think there's a certain amount of time still to go for there still to be strain on the healthcare system with this current surge?
So we hope that things will get better. You mentioned the South African experience a little bit ago, being the lead up to this. It went through and then it went down. Britain, it's going down. It is evidence that in New York, that it may be peaking and going down. In Maryland and in Washington, D.C., it may be going down. And there was some evidence, well, maybe we may be going down here, but that is not any guarantee because one day it may go down, but it goes up. So we may have 35 patients, but then today we have 44. So I think it's a little bit early to say that, but we're hoping against hope that things will get better in the short term.
We've seen lots of doctors addressing this issue of some people who just let's get the Omicron variant, get it over with because, quote, it's mild. And there was a doctor on television this morning saying that is just very foolish. Mild is not necessarily a cakewalk. What advice would you have to people who, when we hear that the symptoms of this are mild, get reassured and don't worry about contracting this?
That is absolutely wrong. because if you're unvaccinated and 80% or 90% of the people in the hospital are unvaccinated, they're not having mild cases, they're dying. Remember, 1,600 people are dying a day in the United States. 1,600, that's a lot. Right, so that means in a 10-day period, that's 16,000 people. Right now, it's 64 million cases, 850,000 deaths. There's nothing mild about that at all. So my advice to you is don't get it. Wear a mask. Make sure you're vaccinated and boosted. So getting all three. So to me, 3 is the new 2. So make sure you do that. It is really important that you get vaccinated and you take care of yourself so you don't get it. Don't get this virus because you don't want to get sick, because we don't know what long COVID looks like for Omicron. We know that something like 25% of people who get the Delta variant may have long COVID, and some people estimate it's 50%. Long COVID, you don't even want to entertain that. So don't get it. That's my advice to you. That is absolutely wrong. Protect yourself, protect your family.